Welcome back to Diabtron, where we discuss important health topics to help you lead a happy and healthy life. Today, we're delving into a crucial subject for individuals with diabetes: foot care. Diabetes is a complex condition that affects various parts of the body, and one area that often gets overlooked is foot health. In this video, we'll explore why foot care is so vital for people with diabetes and offer practical tips for maintaining healthy feet. To begin, let's understand why diabetes can pose a significant risk to your feet. Understanding the diabetes foot connection. Diabetes is a chronic medical condition characterized by high levels of glucose, sugar, in the blood. It occurs when the body's ability to regulate blood sugar is impaired, leading to elevated blood glucose levels. This happens due to a problem with insulin, a hormone produced by the pancreas, which plays a crucial role in controlling blood sugar. There are three main types of diabetes. Type 1. Diabetes. This is an autoimmune condition in which the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, the body produces little to no insulin. People with type 1 diabetes require lifelong insulin therapy to regulate their blood sugar. This type of diabetes is typically diagnosed in childhood or adolescence. Type 2. Diabetes. Type 2 diabetes is characterized by insulin resistance, where the body's cells do not respond effectively to insulin. Initially, the pancreas produces more insulin to compensate, but over time, it may not produce enough to maintain normal blood sugar levels. Type 2 diabetes is often associated with lifestyle factors such as poor diet, lack of physical activity, and obesity. It is more common in adults, but it can also develop in younger individuals. Gestational diabetes. This type of diabetes occurs during pregnancy when the body cannot produce enough insulin to meet increased needs. It usually resolves after childbirth, but women who have had gestational diabetes have a higher risk of developing type 2 diabetes later in life. Common symptoms of diabetes include increased thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision. If left untreated or poorly managed, diabetes can lead to various complications, including heart disease, kidney problems, nerve damage, eye issues, and an increased risk of infections. Managing diabetes typically involves a combination of lifestyle changes, such as adopting a healthy diet, engaging in regular physical activity, and maintaining a healthy weight. Medications, including insulin and oral drugs, may also be prescribed to help control blood sugar levels. Proper monitoring of blood sugar, regular medical checkups, and working closely with healthcare professionals are crucial for effectively managing diabetes and reducing the risk of complications. Diabetic foot is a common and serious complication of diabetes. It is the result of poorly managed or uncontrolled diabetes and can lead to a range of problems affecting the feet. The relationship between diabetes and diabetic foot can be understood as follows. Nerve damage. Neuropathy. One of the primary connections between diabetes and diabetic foot is diabetic neuropathy, which is nerve damage caused by long-term high blood sugar levels. Neuropathy often affects the feet first, leading to reduced or loss of sensation. People with diabetes may not feel pain, heat, cold, or pressure in their feet, making them less aware of injuries or issues like blisters, cuts, or sores. This lack of sensation can lead to undetected problems and complications in the feet. Diabetic neuropathy is a type of nerve damage that can occur in people with diabetes. It is a common and serious complication of both type 1 and type 2 diabetes. Diabetic neuropathy typically develops over time due to prolonged high blood sugar levels, and it affects the nerves throughout the body, with the feet and legs being commonly affected areas. The severity and specific symptoms of diabetic neuropathy can vary from person to person. There are several types of diabetic neuropathy, each affecting different nerves and producing distinct symptoms. Peripheral neuropathy. This is the most common form of diabetic neuropathy and primarily affects the nerves in the extremities, such as the feet, legs, hands, and arms. Symptoms can include tingling, numbness, burning sensations, and pain in these areas. In some cases, it can lead to a loss of sensation, making it difficult for individuals to detect injuries or ulcers on their feet. Autonomic neuropathy. This type affects the nerves that control involuntary bodily functions, including digestion, heart rate, blood pressure, and bladder function. It can lead to problems such as gastroparesis, delayed stomach emptying, erectile dysfunction, and issues with blood pressure regulation. Proximal neuropathy, or diabetic amyotrophy. Proximal neuropathy affects the nerves in the hips, buttocks, and thighs. Symptoms can include severe pain, muscle weakness, and difficulty moving the legs. It typically occurs in older adults with type 2 diabetes. Focal neuropathy. Focal neuropathy is characterized by sudden, specific nerve damage in various parts of the body. It can cause severe pain and muscle weakness in the affected area, such as the wrist, carpal tunnel syndrome, or face, cranial neuropathy. Focal neuropathy tends to develop over a short period. The exact cause of diabetic neuropathy is not fully understood, but it is believed to be related to high blood sugar levels, inflammation, and changes in blood vessels that affect nerve function. Circulation problems. Circulation problems are common complications of diabetes, particularly in individuals with poorly controlled blood sugar levels. Diabetes can affect the circulatory system in several ways, leading to various issues related to blood flow and circulation. Here are some of the key circulation problems associated with diabetes. Peripheral artery disease, PAD. Diabetes can lead to the development of peripheral artery disease, a condition in which the blood vessels that carry blood to the extremities, such as the legs and feet, become narrowed or blocked. This reduced blood flow can result in symptoms like leg pain, cramping, and, in severe cases, tissue damage or gangrene. Microvascular complications. Diabetes can damage the small blood vessels, a condition known as microvascular disease. This can impact circulation to the eyes, diabetic retinopathy, kidneys, diabetic nephropathy, and nerves, diabetic neuropathy. Poor blood flow to these vital organs can lead to complications like vision loss, kidney problems, and nerve damage. Poor wound healing. High blood sugar levels can impair the body's ability to heal wounds. Reduced circulation in combination with neuropathy, loss of sensation, can lead to delayed wound healing, making individuals with diabetes more susceptible to infections and ulcerations, especially in the feet. Increased risk of blood clots. Diabetes can increase the risk of developing blood clots. These clots can block blood vessels and disrupt circulation, potentially leading to serious health issues, including stroke or heart attack. Coronary artery disease. Individuals with diabetes have an increased risk of coronary artery disease, which can lead to the narrowing of the blood vessels that supply the heart. This can result in chest pain, angina, or, in severe cases, a heart attack due to reduced blood flow to the heart muscle. Hypertension, high blood pressure. High blood pressure is common in individuals with diabetes, and it can further strain the circulatory system, potentially leading to complications such as heart disease, stroke, and kidney problems. Foot ulcers and infections. The combination of neuropathy and poor circulation can result in foot ulcers, which are open sores or wounds that develop on the feet. These ulcers can be slow to heal and prone to infection. Due to the decreased ability to feel pain, people with diabetes may not realize they have ulcers until they become severe. Amputation risk. When foot ulcers or infections are left untreated, they can progress to severe stages, sometimes requiring amputation of toes, feet, or even parts of the leg. Diabetes is a leading cause of non-traumatic lower limb amputations in many countries. Charcot foot. Charcot foot is a condition in which the bones in the foot weaken and fracture, often without significant trauma. This condition is more common in people with diabetes, and it can lead to significant deformities and disability. Preventive foot care. To prevent diabetic foot complications, individuals with diabetes are advised to practice daily foot care, including inspecting their feet for injuries, keeping their feet clean and moisturized, and wearing appropriate footwear. Regular visits to healthcare professionals, such as podiatrists, can help in early detection and management of foot issues. Importance of blood sugar control. Proper management of blood sugar levels through medication, diet, and exercise is essential to reduce the risk of diabetic foot complications. Good glucose control can slow the progression of neuropathy and improve overall vascular health. In summary, the relationship between diabetes and diabetic foot is one of cause and effect. Poorly controlled diabetes can lead to nerve damage, circulation problems, and an increased risk of foot ulcers, infections, and other foot-related complications. Therefore, diligent foot care and overall diabetes management are crucial to preventing diabetic foot problems and preserving the health of the feet in individuals with diabetes. Preventive foot care. Given these risks, what can you do to take care of your feet if you have diabetes? Taking care of the feet is crucial for individuals with diabetes to prevent complications such as diabetic foot ulcers, infections, and other issues related to neuropathy and circulation problems. Here are some essential tips for proper foot care in diabetes. Daily foot inspection. Check your feet daily for any changes, such as cuts, blisters, sores, redness, or swelling. Use a mirror if necessary to see the bottoms of your feet. Early detection of problems is critical. Keep your feet clean. Wash your feet daily with lukewarm water and mild soap. Avoid hot water, which can lead to dry skin. Gently pat your feet dry, ensuring you pay extra attention to the areas between your toes. Moisturize. Apply a diabetic-friendly moisturizer to your feet, but avoid putting it between your toes, as excess moisture can lead to fungal infections. Trim toenails. Carefully. Trim your toenails straight across and file the edges with an emery board to prevent sharp corners. If you have difficulty with this, consider having a podiatrist or healthcare provider do it for you. Proper footwear. Invest in well-fitting, comfortable shoes that provide support and protection. Avoid shoes that are too tight or too loose. Always check inside your shoes for foreign objects before putting them on. Protect your feet. Don't go barefoot, even at home. Always wear socks and shoes to protect your feet from injury. Make sure your shoes have ample cushioning and fit well. Regular exercise. Physical activity can help improve circulation and overall health. Discuss an exercise plan with your healthcare provider. Don't forget to wear appropriate footwear when exercising. Control blood sugar. Properly manage your blood sugar levels, as elevated glucose can contribute to nerve damage and circulation problems. Follow your diabetes management plan, which may include medications, diet, and regular blood sugar monitoring. Avoid smoking. Smoking can further damage blood vessels and decrease circulation. Quitting smoking is essential for good foot health. Professional care. Regularly visit a podiatrist or foot specialist for foot exams. They can identify issues early and provide guidance on proper foot care. Avoid home remedies. Do not use over-the-counter products like corn removers or callus razors. These can be harmful to your feet. Consult your healthcare provider for any issues. Wear diabetic socks. Diabetic socks are designed to reduce pressure on the feet and minimize the risk of blisters and ulcers. They are typically seamless and made from moisture-wicking materials. Avoid heat. Don't use heating pads or hot water bottles on your feet, as you may not feel burns due to neuropathy. Elevate your feet. When sitting, elevate your feet to help reduce swelling. Seek immediate care for problems. If you notice any issues like sores, infections, or ingrown toenails, seek medical attention promptly. Do not attempt to treat these issues at home. Seeking professional help. Sometimes, despite your best efforts, foot issues can arise. It's crucial to know when to seek professional help. Regular checkups. Visit your healthcare provider or a podiatrist regularly for foot exams. Early intervention. If you notice any issues or changes in your feet, such as sores that don't heal, pain, or swelling, seek medical attention immediately. Diabetic Foot Care Team. Consider building a team of healthcare professionals specializing in diabetes and foot care, including a podiatrist, diabetes educator, and vascular specialist. In conclusion, foot care is a non-negotiable aspect of managing diabetes. Complications can have serious consequences, from ulcers and infections to amputations. By practicing daily foot care, wearing the right shoes, and seeking professional guidance when needed, you can significantly reduce the risk of foot problems related to diabetes. Remember, you're not alone in this journey. Millions of people are managing their diabetes effectively, and so can you. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. We're here to support you every step of the way. Thank you for watching, and take care of those feet. Stay healthy.